Good morning, everyone. My name is Kate Udo from MAPC, which is the Metropolitan Area Planning Council. We're the regional planning agency for 101 cities and towns around metropolitan Boston.
The goal of what we are looking to do in relation to the built environment is basically to provide training and technical assistance to support policy systems and environmental strategies to prevent and reduce chronic disease and associated risk factors and create healthier communities, as well as integrate public health and land use and transportation planning to address the health implications of the built environment and community design.
And so I'm an employee of the City of Fall River working with the city departments who are supposed to be here, but we have one representative right now, and I'm expecting them to show up, planning and DPW and economic development, working with them, but also working with community residents such as John Sylvia of the Niagara Neighborhood Association. So thank you for coming, and Adam, yes, say a few words.
Yeah, so I think most people here know who I am, but if you don't, my name is Adam Recchia, and I work for Serped, which is Southeastern Regional Planning and Economic Development District. We're the regional planning agency for Southeastern Massachusetts, including the City of Fall River. So I just wanted to welcome everyone here today. The Quickishan River Rail Trail is a project that is included in our regional transportation plan, and it has been now for at least since before I was born. So, and as Julie mentioned, we already have phase one built right behind us here. As far as when I was first contacted about participating in an HIA, I thought, oh great, another acronym. I had no idea what anyone was talking about. But after doing the initial training yesterday and working with Human Impact Partners and MAPC, I can let you all know that it'll definitely be a great tool that will give further justification to this important project. So I'm glad everyone can make it here today.
What I'd like to do this is have you pair up, ideally, and I don't know if it'll be possible, but with someone you don't know. And we're going to take 5 minutes.
Right.
We're going to
I need somebody. Well, yeah, my sister kind of gets pointed out.
I'm introducing their partner, and I want to say, not that we don't want to know everything about everyone, but if we can just, we only have a certain amount of time, so. Anyone want to jump in? Thanks.
Okay. Everyone, I'd like to introduce you to Jane. Jane is a city grant writer for the City of Fall River. Her focus is funding for city departments such as the school department, Department of Public Works, fire, parks, CD rep, and sometimes for some nonprofit organizations in the community. And she's here because she wants to support the Quickishan and the health aspects that will be related to it. And also to provide her with valuable information for her further grant writing.
Someone from yesterday can maybe give a brief description of this little tree exercise that we did yesterday. So the point of this tree exercise is to talk about some of these, and in public health lingo, we talk about them as the social determinants of health. So they're things that determine health outcomes. So they determine the decisions we make about our behavior, which then determine health. And this is like the sweet spot for health impact assessment. So if you can have a policy or a land use development plan that will has an impact on some of these root causes of health outcomes and predict how they're going to change health outcomes, that can lend credence or help you advocate for healthier land use development plans, healthier policies. And another way to think about it is this little rainbow. We know that health status is determined somewhat by genetics and also somewhat by access to healthcare services. And these numbers, they're a little different in different studies, but this is basically the idea. But really, the majority of our health outcomes are determined by things that we may or may not have an input into. And so things like our working environment, things like whether we have community centers, our access to education, and broader social policies that promote or don't promote equality or segregation or integration. So health impact assessment, we really try to work on these kind of larger root causes of health outcomes. So we spend a lot of money in this country on health care, and we don't have the best health outcomes in the world. So we know there's a lot. We have an epidemic of overweight and obesity in this country, which has huge costs, and that these health outcomes are not distributed equally. And so for people who are, can't afford to shop at Whole Foods and end up, using a lot of their money on food at fast food restaurants, who are already impacted by poor health outcomes, they're vulnerable to what's in their environment, for example. And so we're hoping to affect some of those conditions. So these are a couple of examples of decisions that were not health decisions, but they actually did have impacts on health outcomes. So in 1996, during the Olympic Games, the city of Atlanta made a decision that we really are worried about all the traffic that's going to happen because of the Olympic Games. So we're going to really encourage people to take public transportation. So they had 24-hour public transportation, more buses, and it did reduce auto travel and congestion. And strangely enough, someone did a study, and they looked at asthma hospitalizations during that time, and it drastically reduced childhood asthma events. So unintended, but great health outcome of pushing for public transportation. Similarly, in the northeastern U.S., you guys have Easy Pass, which did reduce traffic congestion, reduce motor vehicle emissions, reduced disparities. I'm not sure what that outcome is. Sorry. But the interesting thing was there was a reduction in low birth weight infants. There was a study done looking at this association. So some decisions can have unintended impacts. Some of them are not as good. So in the late 40s, early 50s, we made some big decisions in this country to build a lot of highways. And that really led to an increase in sedentary behavior or lack of physical activity, a lot of changes in air pollution and traffic injuries. And as I just learned, it led to, well, I don't know when 195 was built, but it led to the kind of the loss of the Quickishan River. And then we are seeing the results of education policy nationally right now, with disproportionately poor education among low-income and minority populations. And that has obviously grave impacts along the lifespan for people. So what is health impact assessment? This is a big definition. If I was going to give the elevator in a nutshell, it's you look at a policy, a plan, a project, and you try to predict the future health impacts of it in order to inform decision makers that there are benefits or not, there are negative impacts, so that they can be better informed when they're making decisions about these things. So just to say the accepted definition, this is from the National Research Council of the National Academies of the Sciences. So it's a systematic process, so you'll see the steps today. And it uses data from a variety of sources and different analytic methods. So it's not just one type of study. And also, very importantly, considers input from stakeholders. And takes all of that to make the prediction about how health will change if this policy or plan is implemented. And importantly, it looks at population health, but it also looks at how different segments of the population will be impacted. And then once you've predicted negative health impacts or positive health impacts, we want to provide recommendations to either mitigate the negative ones or to make the positive health impacts, make sure that they happen. So that's the kind of long definition. And again, I think this is a little pictorial, like you have your plan in this case. How does it affect all those conditions, lead to health outcomes, and then you provide these recommendations that go back into the decision-making process. I'm getting a little physical activity here because we don't have a clicker. So I think of HIA as these kind of two parts and how it can provide input into a decision. So one is there's a report that you write, and hopefully that report will do this thing where it predicts or judges the effects of this plan. Hopefully it highlights health disparities, provides these recommendations. The purpose of it is to raise awareness among decision makers and the public and to really make health impacts explicit. And I say that only to say one of the things that comes up a lot, and it came up yesterday, is don't we already do this in environmental impact statements and environmental impact reports? And I would say often those go out to things like predicting changes in air quality or noise or that kind of thing, but it might not go out to predicting changes in asthma hospitalization or predicting changes in concentration. Noise can cause changes in concentration or actual health outcomes, so making it really explicit. So that's important, the report, obviously. But we found that the HIA process can be sometimes even more important in elevating health equity in the discussion. And so through the HIA process, you want to engage and empower anybody who's impacted by the decision, the community, and recognize the experience that people have. And building relationships and collaborations happens every health impact assessment you do. And so it is inherently multidisciplinary. So you hope to improve the evidence that people use to make decisions, and then also importantly improve transparency in the decision-making process. So, HIA has been a growing field, and I think in 2007 there was an article written that said there were 27 HIAs done across the country. In 2012, there have been 173 health impact assessments either completed or in progress. This map is always out of date, so we always go places and they immediately say, no, there's like 6 more in our state or whatever. So there's a lot in progress right now. So it says Massachusetts 5. There may be more. I wouldn't be surprised. And you guys are going to add 1 more from Fall River, so that's awesome. So this is kind of our map for today. I said health impact assessment has a structure, so it's a flexible process. It is practiced in a lot of ways, but it does have a structure to follow. And so there's 6 steps. The first step is screening, and that's figuring out whether a health impact assessment would actually add value to the decision-making process. Does it make sense to move forward with an HIA and spend your time doing it? Scoping is figuring out what are your research questions, who is it important to involve, what are your methods that you're going to use, those kinds of things. Assessment is actually doing the research. So, there's 2 parts of it. One is, so you have a plan, what are the existing conditions around that plan? What's happening right now? How much physical activity do people get? What does the land look like right now where the rail trail is going to be? And then the second part is, so knowing what we know about the existing conditions, how will they change once this is implemented? The recommendation stage is providing evidence-based recommendations. Reporting is writing your report. And then also importantly, figuring out how to communicate it and disseminate the results. And then monitoring is tracking, did your HIA have any impact on the decision-making process? Was the decision implemented as promised? And if you can, ultimately, did it have any impact on health determinants? Are people getting more physical activity? Are they riding their bikes more? Are they whatever you choose to want to monitor? So we'll learn a lot more about these steps today by doing. So the principles and value of health impact assessment internationally include democracy. So an important value is engaging the public, informing and influencing decision makers. Also equity, making sure you consider the distribution of your health impacts, making sure you pay attention to vulnerable groups, and in your recommendations as well as your assessment. Sustainable development, judging short and long-term impacts. Ethical use of evidence, so making sure that you're transparent about where you're getting your evidence. If you feel like you don't have a strong argument, saying what your limitations are. And comprehensive approach to health. So making sure you're using a wider determinants of health. So just want to, we talked a little bit more about this yesterday, and stakeholder participation is really, really important in health impact assessment. And some of the early, there haven't been a lot of evaluations of HIA, but some of the early evaluation results, what we're seeing is one of the most important things in health impact assessment is having a diverse group of stakeholders, and that's one of the biggest things that can not ensure, but have an impact on if you have any success with influencing the decision. So, we want to, what we consider stakeholders are anybody who basically has a stake, anybody who's impacted by the decision that you're thinking about. Paying special attention, we believe, to community voices and those who are advocates for vulnerable populations who may not ordinarily get to have a say in the decision. So, but also stakeholders are elected officials, city planners, public health agencies, academics, all sorts of different stakeholders. So we've talked about how we're going to maybe move forward with this very kind of rapid health impact assessment, wanting to get input from stakeholders. And I think we could say a little bit more about that maybe after the scoping step, once you kind of get your feet wet into the HIA and know a little more about what it involves. Does that make sense? Okay. So yesterday we went through a couple of health impact assessment examples that Human Impact Partners has been involved in. We're not going to do that today just because of time, and we really want to dive into the HIA, but I just thought to summarize some of the outcomes that we've seen kind of generally and specifically from some of our HIAs. We've seen HIAs improve designs, so make recommendations for designs of built environment projects, improve policies, land use policies, for example, in general plans or comprehensive plans, contributing to the passage of healthy legislation by reframing the debate to account for health. Specifically in Connecticut, they passed a paid sick days legislation to mandate paid sick days. So a lot of work that we did across the country kind of culminated, and hopefully will culminate in other places, and passing paid sick days. Housing costs that reflect reality better for how much people can afford in a particular district. Increased awareness of health impacts among decision makers. And these are for almost every HIA we've done. New collaborations among community organizations, public agencies, academics, and other stakeholders. And increasing the capacity of different organizations and agencies to include health research and decision-making processes. So we have seen a fair amount of success.
So as we all know, the Quickishan River, I hope we all know, the Quickishan River Rail Trail is an extension of the bike path that's currently running right behind this building. It's a former rail right-of-way that ran from New Bedford into downtown Fall River. It's still active in Westport and Dartmouth, and also in New Bedford as well, but this from about Mid-City Scrap into Fall River, it's been abandoned. So phase 1 of the Quickishan River Rail Trail, there's a map up here of this as well if you want to look at it during breaks. It's about 1.4 miles, and it connects from Brayton Avenue. We'll cross Brayton Ave at the lights where the Route 24 on and off ramps are. And then it will run along the Quickishan River, under Route 24, under 195, to Quickishan Street. And then it will run sort of as an island in the middle of the two ponds on either side of the river, and eventually connect over to Britland Park and the police station over there. There's also a few different loops that have been proposed. Well, first of all, there's the Scholarship City bike routes, which Julie has been working on, and those are just loops that will connect on road to this facility and get you up through the northern end of the city and through other various neighborhoods around here. There's also 2 spurs that we're looking at. One of them to Rodman Street, just to the south of the Plymouth Ave and Rodman Street intersection, and another one potentially to some of the developments over on Quickishan Street as well. So as I said, we are connecting to Britland Park and the police department. There's also a lot of private development along the proposed path, both apartments and businesses as well, and a lot of the old mill buildings that we have in this area. And also, very importantly, a community health center as well. Oh, okay. And I kind of said some of this. It will eventually connect to downtown Fall River through Britland Park and then through some various on-road connections that we've been proposing. It would also connect to the bike lanes that are going to be constructed along Plymouth Avenue as part of a MassDOT project that's, I think, will be underway next year. And I mentioned the Scholarship City bike routes. And on a regional scale, this path is part of the South Coast Bikeway, which is a 70-mile proposed path that one day will hopefully connect from Rhode Island all the way out to the various multi-use paths out on Cape Cod. And the South Coast Bikeway is also part of the East Coast Greenway, which is the massive 3,000-mile multi-use path that's been, I think they've been working on this since the 90s, the early 90s, and now connects from Maine all the way to Florida one day. So this is also part of that major bike trail. Okay. Some of the health issues that we're going to be looking at as part of this project, the big one would be physical activity. And we're talking about physical activity not only from a recreational viewpoint, where we have people using the path for recreation on the weekends or whatever for biking and walking, but also from a transportation perspective, people actually using this path to get to and from work or to get to and from different restaurants or retail, things like that. So sort of our utilitarian cyclists and walkers out there, that this is actually a form of transportation for them as opposed to just recreation. We're also looking at crime and safety. Down here, we do have a map of bicycle and pedestrian crashes around the proposed path, so if everyone wants to take a look at that during some of the breaks as well. As you can see, there are quite a few dots. This is only a 7-year period. So Fall River, it is an urban area, so we have a lot of conflicts between cyclists and pedestrians out there. And from a crime perspective, again, we're dealing with an urban area, has pretty high unemployment, so there are some crime issues, maybe more perceived than actual, but still, there are some issues out there. As far as economic development goes, we are looking at the economic development impacts of this project, not mainly from a tourism perspective, or I shouldn't say mainly, but that is one of the components, particularly since this is part of the South Coast Bikeway, but also just through neighborhood revitalization and things like that. Access to healthy goods and services. As I said, this is going to connect to a community health center, as well as a number of schools in the city, and also different shopping and retail areas. There's a proposed retail development right off of Brayton Ave that this could connect to, as well as all the retail along Quarry Street and Quickishan Street, and the downtown as well. As far as air quality goes, with the bike path, we are looking at reductions in vehicle miles traveled for those people that will be using this path to do an actual commute on. And with that, we see, generally we see air quality improvements. Down here, we have a sort of a technical analysis that we did for this project in order to qualify it for a different federal funding source that funds air quality improvement projects. So I invite everyone to kind of take a look at this. Take it with a grain of salt, because it is just sort of an overview of what we could see as far as air quality improvements go. But again, if you want to take a look at that, that's up here as well. As far as decision makers go, here's some more acronyms for you. The SMMPO actually stands for the Southeastern Massachusetts Metropolitan Planning Organization. And what a metropolitan planning organization does is they manage federal transportation funding for all the transportation projects in an area. Our region is the region south of Boston, but not including the Cape. So the SMMPO would include the funding for this project. The MPO, being a voting body, would actually be making funding decisions for this project. Also, we have the various Fall River city departments, the planning department, the engineering department. They're also going to be decision makers in this process. The EOEEA, which is the Executive Office of Energy and Environmental Affairs, they are also going to be a funding source for this project through the Gateway Cities Parks program. So they're going to have a lot of input into this process as well. And finally, we have MassDOT. The federal transportation funding comes through MassDOT, and MassDOT is also the body that reviews all the engineering design and the right-of-way acquisition and everything for transportation projects. So they'll also be a decision maker. Stakeholders, I already kind of mentioned some of these, but Serped, my agency, which we all remember what that stands for, so I don't have to say it again. This is in our regional transportation plan, so we obviously have a stake in this, and it's also in our, as I said before, part of our South Coast Bikeway plan as well. Fall River Mass in Motion, Julie, mainly, obviously a key stakeholder in this process. And as I already said before, MassDOT, Executive Office of Energy and Environmental Affairs, the City of Fall River departments, and also the Department of Conservation and Recreation, which is the state environmental agency. As far as the timeline goes, this is sort of preliminary, but right now we're doing scoping, data collection, as well as community and stakeholder engagement. That's part of what's going on today, actually. Getting into next month, we hope to have the 25% design of the path itself completed, and also hold some public meetings on the project to really get a lot of the comments and involvement from the citizens that will actually be out there using this project once it's done. And we also hope to have the recommendations drafted by the end of July. August, we'll have hopefully a complete draft HIA, and our reviewers will be able to offer comments on the draft at that point. And then September, we're going to wrap everything up, release the impact assessment, and communicate all of our findings to the different decision makers that I mentioned before. Is that it? Okay.
Okay. And so all of our work for the rest of the day is actually going to be based on what Adam just told you. Okay, so these are the 6 steps of HIA that Kim mentioned, and we are at the first step. A colleague of ours in training likes to say this is the most important step. He then says that for every step. So for our purposes right now, this is the most important step. So in your binder on page 59 is a 2-pager about the screening process. And we like to put these 2-pagers together for each step, just as a reminder of what your objectives are, what you want to make sure you've done by the completion of the step, the key ideas for it, and to give you a list of resources, both in print and online, that you can go to during the step. So we're going to talk through the 2-pager for screening, and the idea here is that at the end of the screening stage, you will have come up with a yes or no answer to, do we want to move forward with this HIA? And in order to do that, there are a few questions that you can go through, and they're going to hit on 3 main ideas. One is about feasibility, another is about timeliness, and the third is about the value added. So just looking at, on the first page of your 2-pager, the essential tasks column. You really want to be clear about whether there is a decision, and if there's a concrete decision that you have enough information about. So you want to know that there's, in this case, a plan that has been put forth, and that you know enough information about it to then determine these other points that we're talking about. You also, at this beginning stage, want to figure out who you think is appropriate to be involved even just in this screening step. And thinking about if you do end up answering yes, we think this is an appropriate topic to move forward with for an HIA. Are the folks who are going to be involved, do they really have the capacity in terms of time and resources to be part of that full HIA process? So these are all things that you want to be considering during screening. So then you want to go ahead, and we're going to actually do an exercise at the end of this in our small groups and really evaluate a project. We're going to do it for the Quickishan, which, foregone conclusion, we are moving forward with it for an HIA, but it will do 2 things. It'll give the group experience just in how you work through screening, and it also might actually bring up questions, identify some gaps, points of concern that could really be useful for the HIA as it moves forward. So you go through, you evaluate and make your decision, and decide yes or no, we're going to move forward, and then you of course want to let all of the folks who participated in that process know, make sure they know what your final decision is. So one of the things I talked about is there going to be value to this HIA? And the idea is that we really want to be sure the report and the process are going to bring information about health to a process to a decision that's not already considering it. We don't want to be redundant. We don't want to recreate the wheel. We want to make sure that there's really going to be some new information added, and that there's at least suggestion or a likelihood of this information being used by the decision makers. Another thing we want to check in about is feasibility. We live in a real world with lots of constraints. Knowing the resources and the time that you have available and that your stakeholders have available, do we really think that this HIA can be done with the resources and within the decision-making timeline? Something that we really like to emphasize in the screening stage is the idea is to work on a perspective plan or a perspective policy. We don't want to be after the fact. We want to be informing before the final decision is made. And so just flipping to the back side of your 2-pager, there are, in terms of the tools, these are some of the questions that we'll actually work through in our screening worksheet, so I don't want to take time going through those now. But I do want to call your attention to the resources column on the right, and this includes a number of websites that include information. For example, on the second line, it talks about HIA readiness questions. It's just some tools that you can use through the process, and those questions are something that we at Human Impact Partners like to use during the screening stage, just hitting on that point of really do our stakeholders have the capacity to contribute what they say they can contribute in terms of time and resources to this HIA if it moves forward. So those are just some resources that, as you're working with HIA after today, you can always refer back to. And just to reiterate this point that we hit on a little bit already, the idea is really to get in there and help inform decision makers before they're making the decisions about the project plan or policy that has been proposed. So here's a great example of what we would consider was a very successful screening project. This was around changes that had been proposed to the vacant property ordinance in Chicago. And to give you a little background, it was going to expand the definition so that banks were included in it. And what's happening here is that a lot of homes were going through the foreclosure process, but while they were in that gap in time of changing hands, there wasn't really clear ownership of the properties or real maintenance. And so it was creating this vacant property issue that was then having impacts on health for the community. It was a big point of concern for lots of residents in Chicago. So this proposal was made to broaden the language of the ordinance. So we had a clear policy proposal that's out there. It fits one of our criteria for screening. Also, the changes to the ordinance were proposed in July 2010, and we knew there was adequate time to fit an HIA. There was going to be at least 6 months before the decision makers, which in this case was City Council, would vote on whether to approve or deny the request for a change. It was very clear among the stakeholders that were brought into the group who had some knowledge of this already that the proposal could impact health and vulnerable populations. In this case, the folks were particularly interested in mental health. So they were looking at the connections between vacant properties and crime, for example, or property values and how that would influence mental health outcomes. The decision absolutely was of concern to the public, and there was some controversy around it, as you can imagine. An expansion of the definition to include bankers might upset some bankers and mortgage lenders. There was a lot of discussion around this. And it was something where health really wasn't being included in the conversation. So we felt like there could be some value added by adding this health frame. There was suggestion from the City Council folks that they were likely to use the HIA findings, and I think that's something that's very important. We don't want it just to sit on a shelf, to operate in a vacuum. We really want the information to be used. And part of what contributed to that is that Alderman Staff were included among the stakeholders of the HIA. So there was really this varied population, or this varied group of folks who were brought together to participate in the HIA and to really lead the HIA.
Yeah.
Okay.
So they're not even at 25% yet. So.
Yeah, did it say in here how much, like the regional transportation?
So, I mean, if you want, you can just number them and just be like,
Engineering, all of that kind
Yeah,
of
so if
stuff are
anything,
being completed right now. So that's where, so it has had a lot of, but still at a good point because anything could change. With a 25% plan, you can still influence changes.
Yeah. Someone wants to volunteer? Right off the bat.
Obviously, the answer is yes. Is there sufficient time to conduct an analysis before the final decision is made? We thought there wasn't a sufficient amount of time. It would have to be expedited slightly, but you have the entire summer to do everything else.
We decided yes. I think the consensus was that there was a short time frame to make a determination, but I think that we could still do that. The overall consensus was that we needed more information, but two of us basically said no because we had determined that 25% of this project was already designed or in the design phase, so how would that help make a determination? But somebody else had brought up that might be good ammunition at a later date if there was any sort of opposition. So I think the consensus overall was that we needed more information.
We thought, although this group is right, we are approaching the 25% design level already. However, we think there still is potential to influence the final design whenever that happens, and also subsequent phases of this project, phase 2 or 3, depending on which you count, what you consider this phase to be. Yeah, I mean, we talked about access to physical activity, basically. Access to the path as a recreational facility and also as a commuting option. Also, potential for crime reductions by just having more people out there, more eyes on the street, so to say. And then also all the good things that come along with increased physical activity, you know, lowering obesity and hypertension, and also as a socioeconomically, it's a sort of a cheap way to exercise. You know, you don't have to join a gym to walk on the path, and this is a fairly low-income area. It meets a lot of the environmental justice requirements, and there's 45,000 people within a mile of this
We
path.
also talked about the mental health of the neighborhood and the property values going up with the bikes because it's in a dense neighborhood. So we talked about that as well. So overall, there's plenty of evidence to impact every level of health, mental health, physical health. So.
Thank you.
Well, we talked about the fact that the plan is in the works, but that at 25%, there is still an opportunity to influence design, but perhaps we need to really focus on specific needs. We agreed on the physical activity increases, but we talked about improvements, beautification of the area, reclaiming the area, increasing pride in the city, so community building from that. We talked a bit about the health center, the new health center, and access to that, and the spurs that perhaps the HIA could forward the expanded planning, which includes access to the brand new healthcare center and its 8,000 patients who would fit into that population of need and vulnerable population.
So this was a sort of get your feet wet example. I'm guessing not any table got through every question, but the idea is that you do want to go through these screening ideas when you have a project or a plan or a policy that you think could be appropriate for doing an HIA. And as I mentioned, you know, you may hit it on the first try, but not necessarily. There are a lot of projects where you decide for either feasibility or time or value-added perspective that is really not the best place to do an HIA. But what sometimes does come out of that is when you say, maybe we don't need the full HIA process and report, but we can use one aspect of that, and that can be really relevant here. So just something to keep in mind as you're moving, including a timeline and decision points. And one question that I know came up at the table in the back in terms of the Quickishan is really what, when we talk about a final decision, what are we talking about? Is that the 25% time? Is that the final approval of the plan? Is that the implementation of the plan? What's our final decision point? You also want to have a list of the folks who are involved just in that screening process and come out of your statement of if you decided to go forward with it, why it was selected. Of course, if you decided not to go forward with it, you're not going to end up with a report, so you don't really need to write about that anywhere. And you want to include in there, in some of your explanations, some of the potential impacts to health and the distribution of health within an area. The resources in terms of time and money that you think you're going to need for the HIA, and a description of the context and the opportunity to influence decision making. So this is really getting you thinking as you're moving into the scoping step where you're going to be laying out your plan for the HIA. Okay, so because this, we are talking about the Quickishan, but we also want to give you an idea of just in terms of a general training, thinking about HIA in general. So what are some other either policies, plans, or projects that you know of going on in your community in Massachusetts that you think could be appropriate to screen for HIA in the future? And I'll just jot down notes. as we do this. And this is the most important step of it. I'm just kidding. But it's a really important step. And so we actually spend a fair amount of time in the training getting your feet wet and actually hopefully moving forward with the scope for this health impact assessment. Sure. Thanks. So the main objective of the scoping step of health impact assessment is to create a plan and timeline for conducting a health impact assessment that defines priority issues, research questions, methods that you're going to use, and participant roles. So on page 67, there's one of these little two-pagers. And if you look at on the left side of the column, some of the essential tasks that you're going to do in scoping, and a really important one is determining who's going to be the lead person and group doing the HIA, who's going to be coordinating, writing, and then amongst your stakeholder groups, setting some principles of collaboration, some agreements for working together, and establishing goals for the health impact assessment. We'll do a little bit of that in a moment. And developing your scope, your research questions, and all of that. Next slide. So I said some of these in those essential tasks, but I think really tangibly, your scope should include HIA goals, the health determinants that your plan is going to impact, and health outcomes. You want to figure out what geographic and temporal boundaries you're going to use for your research, what vulnerable populations you're going to consider and include in your research, develop pathway diagrams, and we're going to actually do some of that today, generate some research questions, and identify some preliminary data sources where you think you can get data to answer these questions and methods. Develop your plan for stakeholder engagement and different roles for stakeholders. Develop your timeline. And even at this early stage, start thinking about how your findings are going to be communicated out to decision makers and the public. So it's a lot that you're doing in scoping, but we'll get started today. So back to this, some of these key points, especially if we hope nobody leaves early, but if you have to leave early, please make sure you leave. So have a great lunch.
What were you asking about, Jim?
And if you guys want to look at other people's pathway diagrams during lunch, please make sure you display them.
Here at Fall River.
Yeah.
So we've gone through screening, we've gone through scoping. We're going to talk about the third step of HIA, which is assessment. And you have a two-pager on this, of course. You know, we like the two-pagers. I think it's page 83 of your binder. And for this one, I'm actually going to talk through both the slides and the two-pager simultaneously, since they pretty much work together. So the idea here is twofold. You want to talk about the existing conditions data. So you want to talk about what it looks like today. And you probably got a sense of this even from the scoping exercise already. And the second thing you want to try to do is talk about some evaluation of what health impacts could be in the future as a result of, in this case, the plan. So if we do the next slide. So in terms of existing conditions, what do we really mean by that? Part of that is gathering demographic information. It can be info such as income, race, gender, age, if you're able to get it disaggregated by place also. That's really helpful, typically. You also want to talk about populations that may be vulnerable to the impacts of the proposal. So really thinking at this really middle part about who do you think is going to be particularly impacted, and how can you go about gathering data, if it's available, that speak to these populations. And you also want to describe factors that are responsible for determining these vulnerabilities, and to understand how the changes could affect health. So the idea here with existing conditions is putting together that picture of what does it look like today. In terms of evaluating potential health impacts, the idea is to take the information you've pulled together from existing conditions, combine it with some of the literature or maybe even some modeling or other sorts of assessment tools that you've used, and we'll talk about those in a little bit, to describe how the current conditions could be affected by the decision, right? And we're doing this all from the health perspective. And because this is an HIA, and part of our focus is not only on the impact to the population overall, but also to the distribution, we, when possible, want to talk about the effects of the proposal in terms of equity and in terms of distribution on health within the population. So this matches up with, I think, the key points on your two-pager. And the idea here is that for existing conditions, so we're just going to look at that first part of assessment now. For existing conditions, you want to gather data that already exists. We don't want to recreate something that's already out there. But there are times when you're going to have holes, and you're going to say, you know what, we do have the resources. We have the time, we have some money, we have some capacity to fill in those holes. And so you might do some primary data collection to fill in. And we'll talk about examples of those. In terms of gathering existing data, some of what you'll look to is just the empirical literature that's out there. A lot of times we also look to criteria, standards, and benchmarks. And these can be at different levels. These can be federal. A lot of times these are included in different plans, local plans, comprehensive general plans. They can also come on the health side from documents like Healthy People 2020. And the idea here is that we're going to talk about how we compare to that benchmark. You also want to gather demographic and health statistics, and we'll talk a little bit about sources for that. Of course, the census and CDC can provide a lot of national level statistics, and sometimes, in terms of the census even, really boil it down to smaller geographies. Environmental measures, and we absolutely want to include that community expertise in terms of focus groups, surveys. We consider that really valuable information, and often it can fill in around ideas in terms of behaviors or perceptions, things that may not necessarily be available through one of these other data sources that were listed. And so we're talking about this right now in terms of existing conditions, but when you're gathering it, you do want to keep in mind that it's also going to come into play when you're talking about predicting your impacts. So it's got sort of a two-pronged application there. So looking more just in terms of a literature review, and this is often an initial step that we'll take, and again, this plays into both existing conditions and predicting your impacts. Absolutely, there are peer-reviewed articles and research that are available through databases like PubMed or Web of Science. Just a show of hands, are there folks who have used these resources before, familiar with them? I'm sure there are going to be a few. Okay. Also, systematic reviews, when available, are something that you really want to look to because they're bringing together information from a few different sources. They're doing some of the work for you. Gray literature is something that we use in HIAs, and sometimes folks raise a question about that, like, is that really valid enough? It's not a peer-reviewed article. We would say that it can be useful, particularly when there's a small geography where you're looking for information that's not necessarily going to be published in a peer-reviewed article. It's just not of that broad an interest. But if it's available from, say, a local organization, you can go ahead and use that. And something you want to do, if you have any uncertainties around it, is really just describe what you think the limitations are of that information. Gray literature also can be really useful for topics that tend not to get reported on as much in the peer-reviewed literature. So let's see, for example, I'd say this is changing somewhat, but just information around certain behaviors doesn't always get reported in the literature, whereas it might make its way into some other sort of report. So what we pretty much say around that is it's a source, use your judgment, and be clear about if you think there's any limitations in using it. So just to give you a couple examples, on the bottom right side of the slide here, something we like to do with the literature is to do a comparison between groups. So this says those earning $15,000 a year are 3 times more likely to die prematurely than those earning $70,000 a year. this is really helpful to us by giving us some comparison between groups. Also, when talking about populations, we can talk about it in terms of spatial relationship to health outcomes. So children living within 500 feet of a freeway have reduced lung capacity compared to those living further away. So it's really bringing in that spatial link. And this is helpful both, you could then pair it with information about how many children in your area live within 500 feet of a freeway, so it can be that existing conditions piece. And if it really related to the plan that was happening, you could use this for predicting impacts by talking about how the plan would affect either how many children are living within that distance, or if you were looking at air pollution around that distance, you could really bring in that linkage. So I mentioned that within existing conditions, we like to really use these different sorts of regulatory criteria and standards, and I think I got a little ahead of myself and mentioned a few of these already. But for health, certainly Healthy People 2020 is somewhere to go in terms of national standards that are set. And in terms of existing conditions, you could talk about how well an area measures up around a certain health indicator in relationship to the Healthy People 2020 standard. The CDC, of course, puts out a wealth of public health data. I will say it's not always at the level you may want. It might be more of a national level, but I think it is a good place, a good starting place, oftentimes. City or county general or comprehensive plans often include a lot of more local standards. And for example, while there may be national guidance on the ratio of park acreage per person in an area, a local jurisdiction may have said, you know what, we want to go higher. We want 10 acres per person, which would be lovely, in an area. And so it's a way to say, here's how we measure up against not only federal standards, but local standards. So that's the general idea here. So talking about where you can gather demographic and health statistics, I'm guessing folks in this room have familiarity with at least one of the sources that are listed up here, if not two or three of them. The Census Bureau has their relatively recently designed American Fact Finder website. Are there folks who have used this before? Seeing some head nods, yeah, okay. So there are a wealth of topics that come out of the Census Long Form and also out of the American Community Survey and a variety of other surveys that they do put out there on information they gather around population. It's often disaggregated by age, gender, race, ethnicity, we'll call it communities of color so I can say it maybe, and population of descent, which is also a category they use to speak to Latino and Hispanic populations. And so they offer on all of these topics that will likely be applicable in your HIA. Something that the census also offers is this information at different geographic scales. Now one caution in using it is that sometimes information, for example, around income that's considered particularly sensitive may not be available at the very smallest level you want. So you may have to look to a slightly larger area than you're considering is your area of interest for your HIA. And you would just use it and mention in your report, this was the closest we could get. The CDC, among a number of the sources that they make available, is the Behavioral Risk Factor Surveillance System, which is an ongoing survey. We really like to cite surveys that are nationally sourced and also that are ongoing, so they give these comparison points over time. It can talk about change over time. And this is really helpful in tracking health conditions and risk behaviors that often aren't captured through other data sources. And of course, your public agencies, quite a few of who are represented in this room, will gather their own information, some publicly available, some proprietary, but it really helps to make good friends with your staff members at local agencies if you are not one of them, and really try to tap into whatever data is already being collected.
So there's a two-pager, and I'm really going to use that, and we're going to do this step of HIA. We're going to have an exercise that I think is very fun. and then have a little break. So, so on page 103, the recommendations, the basic objective is to provide some evidence-based recommendations to mitigate negative and maximize positive health impacts. So if you take the two-pager and turn it to the back side of it, and in the lower left-hand corner, you can see, in a nutshell, we talk about some of the things you should try to be thinking about when you're creating your recommendation. And so one is that they're responsive to the impacts that you predicted in your HIA. So, we could all sit here, and we will in a moment, and come up with recommendations without having done any study whatsoever. We all have our opinions about what should happen with this rail trail. But, you've done a study, and so what you're recommending should actually be responsive to what you have predicted. Your recommendations should be specific and actionable, so that if you're talking to a decision maker and you say, we found this, and here's what we recommend, and they say, well, that's pretty vague, and they can easily not do it. So that's important. They should be evidence-based, experience-based. So as much as you can say, we recommend that we know that traffic calming decreases accidents, or speed bumps decrease accidents in neighborhoods, and we see it in other places, and there's evidence that it works. That will really help decision makers say, well, gosh, I guess we really should do this. They have the evidence. Your recommendations should be enforceable, and they should be monitored so that implementers can be held accountable to implementing them. They should be feasible, so technically feasible, they should be politically feasible, economically feasible. So as easy as you can make it for decision makers to say yes to your recommendations, and do the work in advance to show why it's important and why it's possible to do it. You should look at we talked about this yesterday, look at your recommendations, try to make sure that what you're recommending actually doesn't have their own impacts that are negative. So yesterday we were talking about the Southeast Corridor Park along the Orange Line, and how some recommendations had been made to decrease exposure to crime by putting up walls. But what ended up happening is it actually just trapped people, so they couldn't get away in cases of kind of assaults and that kind of thing. So some negative impacts from the actual recommendation. And this last one is relative to the authority of the decision maker. So you don't want to ask the Department of Transportation to do something that is really the Department of Energy's responsibility, because they're obviously going to say, like, that's a great idea, but we can't do it anyway. So just as specific as you can make your recommendations, it's really going to help the uptake of them. On the front page, some of these key points, I'm not going to go through all of them because I think the criteria actually go through a lot of these, but the first one is, obviously you really need to understand the plan and the local context in order to create recommendations that are going to be even helpful for the local context again. Sometimes recommendations can include, like, we think you should put this in a different place, or alternatives, or we see you want to create these loops and spurs, and our recommendation is that you should do it, and you should think of another one, in fact, and it would improve even the benefits of people being able to access retail, for example. And sometimes the recommendations are, we couldn't actually even find data on something that you're concerned about. And so we actually recommend that you, on an annual basis, do counts of how many people use the park spaces, or that kind of thing. So those are some examples. Sorry, I'm just looking through to see if I haven't covered all of these. Ideally, recommendations, again, should be tied to indicators that can be monitored, and we'll talk about monitoring in a little while, but you want to, again, make sure that you're being pretty specific and people know what's going to be monitored by who and how often, and that you're going to publicly report that out. And so maybe your recommendations are about something that should be monitored, like I just said. And then on occasion, recommendations are not actually even appropriate. think we have very many examples of that, but in our, I know we keep talking about our paid sick days HIA, but it's basically so we don't have to describe a bunch of HIAs and giving examples. But it was a piece of legislation. There wasn't a lot of recommending that we could do besides pass it because we think it's generally good for health. But we did make one recommendation, which was to, there was an exemption for small businesses, and we recommended in the HIA that they not have that exemption because small businesses actually more often than not don't have paid sick days existing already. So the next slide, couple of examples. Oh, I already said the paid sick days one. In the Long Beach Downtown Plan Health Impact Assessment, they were, as you might remember, concerned about local employment, also concerned about affordable housing. So they made recommendations for some local hiring agreements as community benefits, and also inclusionary housing, maybe a percent of affordable housing to be included in the plan, and commercial linkage fees. And then in a health impact assessment we did where they were putting housing basically close to a freeway, we had predicted some asthma and respiratory disease effects. So our recommendation was to install a high-quality HVAC system and locate the air intakes as far from the freeway as possible and have an ongoing maintenance plan. So those are some examples. And what I'd like to do is implement a poultry litter to energy plant here. Have us do an HIA. I'm sorry that we screwed that up. Is have you guys get in your groups and maybe it says 3, but I would like you to really focus and come up with 2 priority recommendations based on your health determinant in your tables. And so what this is going to require you to do is come up with some fictional findings, like that we have completed our HIA, we have found that it's going to, the Quickishan River Rail Trail is going to decrease, in our case, crashes, but only if people access the trail. And so what is our recommendation? So take 15 minutes and come up with 2 recommendations and elect someone to report that out.
Recommendation is that we need to make sure, for safety reasons, we need to make sure that there's sufficient time and signage and traffic calming efforts in place at the entrances, particularly at the entrances and exits to and from the trail and onto and off of city roads and highways.
Who's responsible?
And the person or the entity who's responsible for that, we're not 100% sure, so we have to do a little bit more research, but it's either MassDOT, it's probably a combination of MassDOT and local municipal staff, as well as city engineers.
Is that your recommendation?
Yes.
Okay.
Because our finding was that there would be potentially more crashes at these points.
In this part, we're actually going to take a step out from the 6 steps momentarily. We'll come back to them. And just talk about what some intervention points are for using HIA in decision-making process. There are some natural intervention points for using HIA in its entirety within other planning processes specifically. So for example, over here, when planning is presenting draft alternatives, that could be a natural place to use your HIA to review and provide feedback on the alternatives presented. Further down the line, once a proposed plan has been put out, not yet finalized, again, in planning processes, this could be a natural place to use your HIA. In terms of an environmental review, same idea applies when a draft EIR, or I think draft environmental impact assessment, has come out. That can be a really natural place to insert your HIA. But we also want to bring in this idea, and I think Val brought it up a little bit yesterday, that HIA is one of many approaches for bringing a comprehensive health analysis into a planning process. And as you can see by this, this visual image here, it shares some of the ideas with other processes. So maybe you want to use an idea of providing metrics and data to supplement existing conditions within a planning process, but you want to do it from a health perspective. Or another example is even as early on as visioning your goals within a planning process. If you have that connection with the planning department, maybe you can use some of your public health goals to really get involved early on. And you may not need the entire HIA to do that. So we like to present that idea, and we use this little woven pattern to try to convey this image that there are a lot of ways to weave public health into planning process.
Because it's important to talk about how you're going to want to report out your results. On page 111, there is another two-pager. I'm actually not going to rely on this too much because I think we go through most of the things on it, but for your reference, there it is. So the objective, two parts we talked about is to develop the HIA report, and then the second part, communicate the findings and recommendations. So reporting formats. So you guys have seen a million reports, right? But it doesn't, your HIA does not have to necessarily be a 200-page document. Quite often it is. But it can also be something else, like the MBTA Fair Hike service cuts. How long was that? 30 pages. Congratulations. Awesome. Sometimes I think Val, you were saying, you know, and it's not HIA necessarily, but we've had HIAs that are comment letters on draft EIAs for one, comment letters on general plan updates. So really, you know, a 10-page comment letter bringing the health evidence as a comment in a public review process. Formal reports. Presentations are a form of reporting, so creating a presentation. Some things that we don't have on here are things like one-page fact sheets, executive summaries that are released on their own. Also, peer-reviewed publications. So there have been a couple of HIAs that have been have just been submitted as peer-reviewed publications. And that's their only report. So the living wage ordinance in San Francisco is one of those, for example.
Last step. So we're down to monitoring, and as you'll remember, this is obviously the most important step in the HIA process. So you have a two-pager in your binder. It's on page 127. And talking somewhat quickly through that, the idea in monitoring is that we're focusing on outcomes. And there's three ways that we talk about that within HIA. So we're interested in what the outcomes were in terms of the decision-making process and the final decision itself. We also want to know what happened in terms of the implementation of that decision. And then finally, and this one tends to be much more long-term, although not always, what were the impacts of the decision on health? And I say that tends to be more long-term because sometimes if you're talking about things like chronic disease, you're not going to see the results necessarily within 5 years. If it's more related to something like vehicle collision and injury, that might be more immediate feedback that you can get. You want to evaluate the process of conducting the HIA. So one of the essential tasks is to develop an evaluation plan and to really be clear about what your focus is in this evaluation. During it, you want to consider how you built evaluation into the HIA process, how you meaningfully included stakeholders. You can talk about what you think went well, what you think could go differently. It's really your time to be sort of introspective about it. Sometimes we do evaluations internally. We also suggest that you could have someone from the outside come in and lend that sort of additional perspective, maybe more of an unbiased person to help you conduct this sort of evaluation. On the back of the two-pager, we list some example evaluation questions. And what you'll notice is that when we go ahead and do our own process evaluations, we try to address both the process of the HIA overall and how we work within each step of the HIA. So that's sort of how we structure it, just for our thinking.
Here we are. You guys have done an amazing job lasting through today and learning about HIA. So what is our work plan? So we kind of mentioned it, but we've already defined the health determinants, and not to say these are everything that the HIA will look at, but we started to define the research questions. We talked about some really good goals for this HIA. We identified at least some of the partners who are in the room, and we identified stakeholders throughout the day today. Not necessarily all of their roles, but so that might be for work after today. The potential issues for the HIA scope, we talked about data needs and some of the ways to get them. Didn't really talk about support needed to move forward, although we did talk about basically MAPC is conducting the HIA, and Adam and Julie will be helping out with all the kind of, engagement of stakeholders and that kind of thing. And we hope you have filled out, or you will fill out that little survey about how you might want to be involved. Figured out, kind of talked about other resources for the HIA, talked a bit about the project timeline. We've talked about the project timeline. And then I think Peter talked about some concrete next steps. So I think we're pretty good with this. Questions? You guys did a lot of work today, so pat yourselves on the back. So just to note, we mentioned this yesterday for those of you who weren't there. There are a couple of standards of practice in health impact assessment, so it is a flexible process, but a bunch of practitioners met, practitioners in North America met and talked about what are the minimum elements that we as practitioners think should be in a HIA. And so you have a copy of this at the end of your binder. So it includes minimum elements, it's like half a page or a page or something. And then it also includes, if you go above and beyond, what would that entail? And that's a few more pages. So there are some standards that we like to hold ourselves to. There's also, we mentioned this yesterday, the National Academies for the Sciences also produced a book about health impact assessment. And similarly, it's much longer, but it talks about kind of some of the standards and everything. If you guys don't want, do you want me to go through this? But it's right there in front of you, so it's basic. Oh, so here we are, some tools and resources. Go to our website. Everything we've talked about is here. You can even download, if you want them electronically, the slides, not these specific slides, but generally the slides that we use in the training. And I only say that because if you want to be making presentations to stakeholders about health impact assessment and you want to use some of these slides, you can feel free to go ahead and do that. We always like it if you give us a little bit of credit. But, the National Research Council report, so you can Google that. That's what we have all these resources online electronically too. San Francisco Department of Public Health, leaders, really in the country about HIA. Wisconsin they've really built their capacity in the state to do HIA, so they have a really good website too. We mentioned yesterday more the Health Impact Project, which their website is a really also good resource for HIA around the country. And the University of California, Los Angeles, they have this clearinghouse where you can also get a lot of tools and a lot on the web about HIA. Is there? Oh, and if you want to, you can become a member of a very exclusive group, the Society of Public Health Practitioners Health Impact Assessment. This new group, I don't know, I think they're probably a couple hundred members, maybe less. Doesn't cost anything to join, but looking to move forward the practice of HIA.
And I would just add that in part of that group, it's for any level of experience with HIA, and part of it is including a sort of mentoring aspect. So if that's of interest.
So I would also say, Human Impact Partners, we're going to continue to be working with, the project team on doing TA as these HIAs are being completed. Also, I mentioned to somebody, if you are interested in doing an HIA, you want to talk through an idea for an HIA, we're always happy to do that. And so we have cards, or you can just go to our website, or all our email addresses are on there. So we're always happy to entertain ideas. Thank you so much, and thank you very much to Julie and Adam, who touched all of your lives to get here, and to Kate and Peter, Jennifer, for really